the cost of insurance to those in the private markets going through the roof. I have employers in my state Senate district and now in my congressional district who have seen over a 3-year period of time their health insurance costs go up 100%. We also saw delayed care, and as the gentleman from Arizona knows, delayed care might as well be denied care.
Would the gentleman,
I do yield.
Would the gentleman yield just on that point? This, by the way, our colleagues are saying we ought to do a Canadian-style system, something that gets the government more involved. Well, we all know Canada has a single-payer system. Some of us believe that those on the other side of the aisle want to create exactly that, a single-payer system, but they just want to transition it to it. I think it's very important. You know, you said the right to access to care is not the right to care. Actually, that's exactly what the Supreme Court of Canada ruled about their single-payer system. Chief Justice, and this is on this chart next to me, which I thank the gentleman for allowing me to put up, Chief Justice Beverly McLaughlin of the Canadian Supreme Court said in an opinion which was issued in 2005, access to a waiting list is not access to health care. In an opinion in which the Supreme Court of Canada ruled that you couldn't be forced to stay in their system. You had to be given the right to get outside of the government program and get the care you need. So access, to the point the little gentlelady was making, access to a waiting list is not access to health care.
Now, just reclaim my time a second. Now, this Supreme Court justice, she was no right-wing conservative.
She was no right-wing conservative.
I mean, by political standards in America, she'd be considered liberal. She's
a very liberal justice.
And yet she is saying that this socialized system
didn't work.
It doesn't work.
It doesn't work.
And access, just because you got insurance, doesn't do you any good. You can have a free C-section, but if you have to wait 12 months, it doesn't do you much good.
If you have to wait 12 months for a free C-section, it doesn't do you much good at all. I believe our colleague could comment on that more credibly than we could. I just want to make the point. We don't want this. We Republicans want a system that responds to patients. We want patient-centered care. We don't want to give Americans access to a government waiting list. We want to give them access to actual health care.